One of my biggest passions in life is the sport of basketball. I love to watch it and I love to play it. Playing for my junior year in high school, playing for a small basketball club, I jumped to grab a rebound and accidentally land on someone's foot and severely sprained my ankle. After visiting the doctors, I find out that I have a broken foot that would require surgery and months of rehab. So today I base my speech on horrific injuries risking basketball careers. The purpose of my speech is to raise awareness of some of the most common yet horrific basketball injuries and ways to treat them and to prevent them from happening. Basketball is a fun sport to play, but it takes a toll on your body because of its physical nature, and it's a very dangerous sport because it leaves almost any part of your body vulnerable to various injuries. Basketball injuries can be career-ending, and it could even leave people crippled for life, and raising awareness of these injuries is the best way to educate people about ways to treat them and to prevent them. As I stated, I have experienced a horrific basketball injury before, and it's one of the reasons why I chose this topic. Some of the most severe basketball injuries include ankle sprains, ankle injuries, knee injuries, and concussions. Ankle injuries are the most often occurring injuries in basketball because the sport involves movement of ankles while dribbling the ball, shooting the ball, and while running. According to the American Academy of Sports Medicine, ankles are anchors of our leg, and without enough preparation and equipment, injuries will invariably occur. Also, excessive pressure and overload of your ankles causes ankle sprains. Wearing protective basketball shoes that have padding around the ankles is one of the most effective ways to prevent ankle sprains. Also, players tape their ankles to limit any excessive movements while they are playing. Treatment of ankle sprains include icing the area for no longer than 20 minutes at a time and also elevating the ankle to keep the blood circulation going. Now moving on to the second most frequent occurring injury, which are knee injuries. Most knee injuries in basketball occur from knee-to-knee collisions, which could rupture or break the ACL in our knees. According to Dr. James Naismith, basketball requires extensive stop-and-go maneuvers, which put the ligaments and menisci of the knee at risk. Direction and speed-changing exercises have medically proven by the American Academy of Orthopedic Surgeons as ways to prevent knee injuries. And it may sound simple, but stretching your knee in several ways before playing the game is also proven to limit knee injuries. Treatments of knee injuries include surgery in severe cases and also the RICE treatment, which is the rest, ice, compress, and elevate treatment, which also has been proven to limit knee injuries. Lastly, I will discuss the worst injury in basketball, which is concussions. Concussions are considered to be the most dangerous basketball injury because there is no way to prevent them from happening, especially in the game of basketball. Because unlike football and baseball, basketball players aren't allowed to wear helmets while playing the game, which leaves the head area very, very vulnerable to injuries. And injuries are part of the game of really any sport, but it's important to educate the players on ways to prevent them and to treat them. The way in which I sustained my injury was a freak accident, but the game of basketball shows no mercy because an injury can happen at any moment and in an instant. I'm not trying to scare people away from playing the sport by telling you about these injuries. I'm simply making you aware of them so you are better prepared for them if you do sustain an injury and ways to prevent them. Knowing about these injuries will better prepare you for them if you do ever sustain an injury. Injuries while playing basketball, or for that matter any other sport, is part of the game. It's going to happen, but because of them not playing is not a good enough reason to not play the sport that you love.